Hi everyone, this presentation covers Chapter 7 on the overview of study designs. This is the first chapter in the Step 2 on selecting a study approach in the third edition of Jacobsen's textbook, Introduction to Health Research Methods, a Practical Guide. So in this section, you will go over the second step, which has an overview of several of the most common primary study designs. Now in this chapter specifically, you will learn that many types of observational and experimental study approaches are useful for clinical and population health research. Here is an outline of the chapter. Section 7.1 covers types of study approaches. Section 7.2 covers primary, secondary, and tertiary studies. Section 7.3 covers observational and experimental studies. Section 7.4 covers exposure, disease, or population formats. And Section 7.5 covers study duration. Section 7.1 covers types of study approaches. In this chapter, you will learn about 8 common study designs. There are single designs, variations of those designs, or hybrid designs of 2 or more approaches that are used. Study design should be selected based on what is most appropriate for the goals of the project. So you want to pick the goal first, then decide what the study design is. So Figure 7.1 goes over a summary of different study approaches. It discusses these 8 study approaches, which include the case series, cross-sectional studies, case control studies, cohort studies, experimental studies, qualitative studies, correlational or ecological studies, and review and meta-analysis. So these will be just briefly introduced to you in this chapter, and then there will be a lot more information about each one of these in the following chapters. And so this figure really just gives the goal for each of these different study approaches, and so you can come back to that and review on your own time. So what should you consider when selecting a study approach? Some of the things that you want to think about are, can the research question be answered using existing secondary data sources, or do I need to collect new data? If new data needs to be collected, is an observational or experimental method most appropriate? Is it something that needs to be experimented on, or can we just observe and describe what is already happening? What is the exposure status, the disease status, or membership in a particular population? And what are the time and financial considerations? Section 7.2 goes over the differences in primary, secondary, and tertiary studies. So a primary study collects new data. A secondary study compiles existing data. A tertiary study extracts data from the existing literature. So Figure 7.2 goes over some key considerations for these different types of study approaches. So looking at primary studies, so our study plan, if we have a primary research study, is going to be to collect and analyze new data. And some of the key questions that you have to consider are, what are the possible source populations, and will it be possible to recruit enough participants? For a secondary approach, you're analyzing the data already, so you are not able to determine how many participants need to be collected because the data's already been collected. But some of the other things that you may want to think about are, what are the possible sources of usable data files, and what research questions can be explored with the available data. For a tertiary study approach, you're reviewing and synthesizing the existing literature. So this is actually going to the abstract databases and abstracting the data, or extracting the data in order to find out if you can compile the studies. And so some of the things you might have to think about here is the access to adequate library resources, and what to do if you cannot access them. Then Figure 7.3 goes over some of the different functions for each of the different approaches and how it lines up with the specific study designs. So starting off here at the top, if you are analyzing the published articles, this is a tertiary research design, and really the only research design that can be done in this manner is a review or a meta-analysis. If you're analyzing population level data, you would be using a secondary research study design where you're using existing data, and this is a correlational study. Now for analyzing individual level data, so population level data is actually just data that's reported about, say, a specific country, a specific town. It's not actually individual. But individual data can be a primary study, and it can also be secondary research here. Then you can also look at individual data in a qualitative manner. And so the chapters going forward will discuss quantitative methods versus qualitative methods, a case series, cross-sectional, case control, cohort, and experimental study are all examples of quantitative study designs with an N. And a qualitative study design can be done for primary and secondary research, but it's a different approach. Section 7.3 goes over the differences in observational and experimental studies. An experimental study randomly allocates participants to either an exposed or an unexposed group in intervention studies. Observational studies are really when you would just describe the participants based on their observation or based on their report. So it allocates participants based on exposure status in intervention type studies. So an experimental study is a randomized clinical trial. So if you had two groups of people and you were testing out a new drug, you would randomize them to one group that had the new drug versus a placebo or the old drug. In an observational study, if you wanted to do the same thing, you're basically just, moving people around based on what drugs they're already taking and then just observing them in the future. You're not actually randomly assigning them to what drug they're taking. Epidemiology is the study of the distribution and determinants of health in populations. There are two types of epidemiologic study designs: descriptive and analytic. A descriptive study design really is meant to be a prevalent study. It describes how often various health-related exposures and outcomes occur in a population. So these are questions like who, what, where, and when. Whereas the analytic studies go more detailed into the protective factors or risk factors for various health outcomes, or to test the effectiveness of an intervention. So these are the whys and the hows. So figure 7.4 goes over these different approaches. So here we can see our observational approach here. For descriptive studies, we have a case series and a cross-sectional study. Then we have an analytic study that is still observational when we are conducting a case control and a cohort study. And then the experimental study falls under the experimental here. And this is often called the randomized clinical trial or randomized controlled trial. So section 7.4 reiterates this exposure to disease or population model that this textbook really structures all research on, and that research questions should really emphasize that exposure, disease, and population, and that really needs to be taken account into creating and choosing the study design that you use. Figure 7.5 goes over the population selection for each different study approach. And so you can here see how you can have everything set up a little bit differently, and then it tells you a recommendation for a study design. So for example, let's say you wanted to select participants based on a disease status. So if you know that individuals have a disease and there's no comparison group, it's considered a case series. You're just describing people with the disease. You're making no comparisons. if you had individuals with the disease and you wanted to compare them to individuals without the disease and look back at previous exposures, then you have a case control study. But what if you started off with participants in a specific population and you just wanted to describe their health at one point in time? This is a cross-sectional study. But if you wanted to look at their health now and then look at their health in 5 years and in 10 years, so say multiple points in time, it may be a cohort study that you're wanting to do. But then you may also select participants based on exposure status. So if you want to observe the exposure and not make any changes, so an example of that could be, say, smoking. You want to compare smokers and non-smokers, but you're not trying to randomize people who didn't smoke before to smoke. You would have a cohort study because you're just following them over time to see if they develop some sort of disease, let's say lung cancer. But if you wanted to assign the exposure, so this could be, say, to follow people to test the effectiveness of a new drug, then this would be an experimental study. Section 7.5 goes over study duration. So it's really, really important to think about time, feasibility. The time available and required for collecting and analyzing the data varies from study to study. So if you have a limited budget, a limited timeline, then it's going to be challenging for you to conduct your study. So you really want to make sure that your study approach aligns with your resources, time constraints, and expectations for when it needs to be completed. So figure 7.6 goes over the time frame for primary data collection. And so here it has at the bottom this arrow here, and it goes from short to long. So here's our study duration, and it outlines the different study designs based on the amount of time that you have. So for a cross-sectional and a case control study, all of your data can be collected at one time. So this is a pretty short duration. Then if you are collecting all data at one time, but some information needs to be collected in the future, it could be, say, a case series and qualitative. But then if you have a study where participants must be followed forward in time, it's going to be much longer, and these are the cohort and experimental studies. Then figure 7.7 has a great flow diagram for selecting a study approach, and so these are all really useful tools for selecting study designs. Let's say we started off with this first one here. So the question being, are you collecting new data? If your answer is no, your study design is secondary or tertiary. If your study is yes, then you have to ask yourself, are you doing an experiment? If the answer is yes, it's an experimental study. If it's no, then you need to look at, okay, what am I focusing on? Am I focusing on my exposure? If it's the exposure, then it's going to be a cohort study. Am I focusing on differences in disease? Then it's going to be a case control or a case series study. Or am I looking at the population? And this would be a cross-sectional or cohort study here. So that is it on Chapter 7 on an overview of study designs. The following chapters will go in more detail of each of these different designs. Thank you for listening.